Is there a way to benefit patients and reduce costs? I'm Jill Horner. This is Comcast Newsmakers. With me is Roger Baumgarten. He is the Director of Media Relations for the Hospital and Health System Association of Pennsylvania. Thanks for being with us.
Thanks for having me.
You were actually the recipient, your organization, of a grant from Medicare. This is a 2-year grant. It is actually part of a program called Partnership for Patients. Talk to us about this partnership and why Pennsylvania was a recipient of this grant.
Well, by way of background, Pennsylvania has been very much a leader in the area of patient safety and quality, in the areas of infection prevention, infection reporting, and the like. So this is a way to build on it. And this past December, the Centers for Medicare and Medicaid Services created hospital engagement networks across the country, and we are now one of 26 of these networks across the country that is addressing certain targeted conditions in hospitals that are deemed to be preventable. Wrong site surgery, adverse drug events, blood clots, and the like. So we are working with currently more than 130 of our hospitals in the state for 10 of these targeted areas to try to improve on the numbers.
So that's the overall program, and the goal is to reduce preventable harm by 40% and reduce preventable readmissions or hospital readmissions by 20%. So those are the overall targets, and Pennsylvania is actually taking a slightly different approach than the other grant recipients. You're actually taking a more comprehensive approach than some of the other state recipients of this grant.
Yes, we are. A lot of the states that have these networks are doing it only with their general acute care hospitals. And in our case, we're involving the whole continuum of care. So we're including ambulatory surgery facilities, long-term acute care hospitals, and rehabilitation hospitals as well, so that we're coordinating that care for patients as they move from facility to facility.
Now, when you look at the overall healthcare system, if you're able to reduce preventable readmissions or reduce preventable harm by 20%, 40%, whatever the percentage, what does this mean for the individual patients? Because when you're talking about those percentages, you're talking about individuals.
You're talking about people, and this is about making people safer and improving the quality of their care so that they don't have to return to the hospital unnecessarily. And it's also better for the hospitals in that they're delivering the care in a more efficient way, more cost-effective way, and reducing the cost to the system overall.
So benefits to people, benefits to the system, meaning monetary benefits.
Yes, yes. And in fact, the Medicare program has some payment incentives and penalties in place depending on how hospitals perform on some of these measures. So it's very much in the interest of hospitals in terms of maximizing their reimbursement levels to make sure that they do right by the patient.
As we mentioned, there are 10 different targeted hospital-acquired conditions, including slips and fall reductions, ulcer prevention, pressure or ulcer prevention, common things that can happen in a hospital setting. What's the overall goal for this study? What's the time frame?
The time frame for this particular Partnerships for Patient projects is 2 years, so it'll go through the end of 2013. But we don't view this as a one-time situation. For us, improvement in safety and quality is an ongoing effort, and we're always striving to make our hospitals as safe as possible for our patients.
And we just have a short time left, but as we mentioned, in Pennsylvania, you're including a wide variety of healthcare systems. Why is that so critical here in Pennsylvania, and what could that mean on a national level?
Well, it's important because patients often, particularly a lot of the sicker patients, move from facility to facility, and to be able to have those handoffs be cleaner and safer is better for everyone.
Thanks so much for being with us.
Thanks for having me.
We've been talking with Roger Baumgarten. I'm Jill Horner.